Hey, everybody, it's David Kemp. I'm your host of Highway to Health podcast. And I always thank you guys for being here, for listening, for tuning in, because what we try to do here is we try to celebrate and give a platform to the people, the organizations that are committed to improving the three important things for our patient and provider community, which is access to care, experience while getting that care, and then, of course, improving the outcomes of the patient population. We've had some tremendous thought leaders on this show over the last 2.5 years. And we're fortunate to continue this episode, to continue this open road journey on celebrating these awesome thought leaders and organizations. And that's why I'm really excited, honored to have our guest on the show today. His name is Andrew Parker. He's the CEO of Papa Health. We're going to get into a lot of topics. He's serving, and his organization is serving a really special demographic, and we want to celebrate that, learn more about it, and I think you're going to enjoy. Andrew, welcome to Highway to Health.
Thanks for having me, David. Very excited to be here.
Well, we're glad you're here. You know, if you've seen any of the previous episodes, you know what my first question is going to be. It's about your own physical and mental habits that help you perform at a top level, you know, for those that count on you, for those that depend on you the most. And so if you don't mind, before we get into business, why don't you share a little bit about, you know, maybe a thing or two that you've implemented in your life that helps you stay at the top of your game, both mentally and physically?
Thank you for having me. Very excited to be here today. And I'm happy to tell you about my personal approach to things, as well as talk about Papa. For me, it's critical, and I presume for everyone, but it's something that I've always had in my life, which is exercise. I've always, since I'm 15 years old, started to do weight lifting and training, and it's always been very positive for me. A good way to, you know, kind of think about my life from a mental health perspective, and just feel good and, you know, get away from my daily life. But actually the biggest thing I've implemented in the last 2 years is running. I was never a runner. Couldn't run more than a mile, probably. Maybe I did a 5K kind of walk run every few years for charity. But outside of that, not much. And about 2 years ago, I thought I would get into running. And actually this Sunday, I just finished my second half marathon, which is just very hard to do and takes a lot of dedication. But for me to get away from work, get away from my daily life, and just focus on something that has nothing to do with that, you know, it's definitely a meditative experience for me. I also like meditation as well, but I would say running is my number one new format of activity that helps me in my daily life.
Are you an indoor or outdoor runner?
I'm 100% outdoor. I do not use treadmills ever. I do live in Miami, Florida, and I tend to run in hot, humid weather. Actually, this half marathon this weekend, everyone said it was so hot. For me, it felt like a normal Sunday.
There's something about being outdoors too.
Yeah. I mean, I was reading the other day, someone was saying the number one way to learn about a city is by running through it, you know, on your feet, or walking technically. And so when I travel, which is quite a bit, whether for personal or for work, I always try to run in that city. You really get to see what's happening on the ground, which I love.
Just being in nature. I'm a big outdoors guy. I love being just connected. And there's something about when you're outdoors, when you're in the environment, you separate from, you know, this digital world that we all live in, and that's a good break for your brain and for your body.
It is. I'm actually going. Another thing I love doing is snowboarding and hiking, but, you know, and I do it at the same place, typically in Colorado, and just being out in nature with the trees, especially snowboarding, flying past those things, just really clears your mind and gets you away from the, you know, try to get a little bit of a digital detox.
And I always feel like my best ideas, my best strategy comes from those times. And I bet it's the same for you. And I bet it's really paid off for Papa.
Yeah. What's funny is when I'm running, usually, you know, halfway through my run, I'll come up with some idea that couldn't possibly think about, you know, looking at it all day. And I would say, you know, hey, and I don't even want to say it because my phone will hear me, but I call out to my device and ask it to take a note, and then later try to interpret, you know, what I was saying and make it more articulate. But the amount of ideas you come up with, and it's like when you kind of take a step back to try to solve some of your hardest problems. So couldn't agree more.
Yeah. Well, what I'm looking forward to discussing today is a lot of times my conversations are around technology and platforms and efficiencies and automations. And we'll get into some of that today. But, you know, before we get there, you know, I want to take a moment. And in my introduction, I talked about how, you know, this podcast is meant to celebrate companies and people just like yourself. I want to really kind of dive into and applaud Papa for what you guys are doing, because I had a mentor tell me recently that all of the technology, all the efficiency, all the automation is great, but nothing happens in healthcare without the caregiver. And Papa is a good example of this. You have found a way, Papa has found a way to deliver trusted caregivers to a patient demographic that needs you the most. And you found a way to deliver that care in a setting that's most comfortable for that patient population, which is their home. And I'd like you to share with us, what does it mean to you personally? What does it mean to Papa to be able to deliver such an increase in access to care for the patient population that you serve?
It is wildly powerful. We've been doing this for 6 years. I started Papa originally to help my grandfather, Papa, hence where the name came from. And I realized it with him, and I've just been trying to essentially develop that relationship over and over again across the country. In 2023 alone, we did over 1 million visits in over 7,300 cities with an average rating of 4.8 out of 5 stars, which is something we're very proud of. Members absolutely love Papa, and members need Papa. And so I thought if we could marry a service and a product that people need and want, that would be very powerful to not only help them in their daily life, but also help improve their health outcomes and ultimately the healthcare system. We were in Y Combinator in 2018, and the famous Paul Graham, or PG as he goes by, says, it's better to have 1,000 people that absolutely love your product versus millions that have downloaded it and just kind of like put it to the side. And I remember reading that, and we didn't have 1,000, we had 10. But we had 10 older adults that completely were engaged and loved and got value out of our service. And that was like a big aha moment for me. When I quit my job in telehealth, I came from the telehealth world, part of the early days there, and realized we had something unique, a healthcare product that people, older people that are generally difficult to engage, love Papa and love our service. So it feels something that is just amazing because the amount of nuance and personal needs that people have is very interesting, which could change in a very dramatic way in a very short time period. But if you have a caring, thoughtful, high quality human in the home that you trust, you could really move the needle on their life in a very positive way.
And you touched on trust. In every phase of healthcare, whether you're a salesperson trying to sell in healthcare, whether you're a patient looking for a doctor to render care that you need, everything in healthcare is built on trust. It's too important. The impact's too great for there not to be trust. Tell us how you've built that trust with your patient demographic, with your patient community.
We think about this all day long. We've built this product and service from the ground up specifically to provide an engaging, trusting service for all of our users. We have about 30,000 pals on the platform. They all go through a very strict onboarding process, which we continually enhance and have continued to enhance over time. Actually, in the last 12 months, we added 30 plus trust and safety features alone, including one we just announced yesterday on our LinkedIn, which is specific to an emergency button that is available to our pals in the home if they do need support for themselves or for the members, because situations can happen. But we take them through a very strict process. And then once they're on the platform, they've gone through the background checks and the training and the enhanced tracking. We want to make sure that they're doing what they say they are throughout the process. But 99.9% of the time, we have an amazing experience. It's how to make it 100% of the time. It's something we think about on a daily basis. Because, again, I built this for my papa, for my grandfather. I want this to be a safe and good experience for everyone that gets to use it. And we're very proud of the progress we've made on providing a really safe and great experience for members. And frankly, a lot of it is choosing the right pal. We initially used college students, which are great, but we've since evolved to what our current demographic of a pal is 80% female. The average age is between 30 and 40 years old. They have some sort of healthcare experience. Most of them are what we call former family caregivers, like my mom, whose parents passed away, who was caring for her parents, and now has some extra time and wants to provide care and could do it in a mission-oriented way. Our pals are typically not doing other home care services. Our pals are typically not part of Uber or DoorDash. These are great services, but these are really mission-oriented individuals that want to care for people. And they tend to be paired with a preferred member, so there's a preferred relationship. where every week Andrew shows up at your house. And that also lends to better trust because I already know you, we're friends. And over time, we build a better relationship. And through that trust, we can support people in more ways, which we are doing now, which I could talk about shortly.
And that, you talked a lot about experience, and your patient demographic is one where might be less willing or adopting of new technologies, new services, because they've done it a certain way for the majority of their life. How has this model improved the experience for your patient demographic? And how have you gotten adoption on a new type of service, maybe even a new platform with the demographic that you guys serve?
Yeah, what's interesting about the older adult demographic, it's like the largest group of people, specifically around like different cohorts. So you talk about like teenagers, that's like a very short group of people. You talk about like adolescents or like younger adults, that's another group of people. While older adults, it's like 40 years. And so my dad turned 65 in 1 month from today. He's going to be eligible for Medicare for the first time. He actually ran a tech company before MD Live prior to this. And so he doesn't need that much help from a Papa Pal. My grandmother, who's 87, who's a little bit wobbly, who has some memory issues, who is generally healthy but doesn't have a car, and frankly, she's lonely. She lives an hour away from me, but she knows how to use iPhone. She has an iPhone. She knows how to use text, but she doesn't want to use an app. So we developed technology that is specifically to support the older adult based on their needs and their capabilities. And so you could call our 1-800 number, talk to our amazing care team, and go through the process and onboard that way. You could text us. We have a text messaging platform that allows us to engage with you in that way. You could reach out to your preferred pal. Maybe you don't feel comfortable with anything. You just want to call Andrew, your preferred pal. He has the ability to support you in new ways through the technology we've developed. We've recently launched our member web portal, which is not this like crazy portal where seniors have to go around and navigate all these different features and makes it really complicated. It's a single use case magic link, no password required, authenticated in the background, which essentially means very, very easy for older adults. They click a link and says, Andrew's on his way. They click a link and says, I want to reschedule. They click a link and says, I want to have a new visit. They click a link and say, I have a doctor appointment next week. Can I have Andrew come out? And it's all built around their needs. Most older adult companies or services are actually developed around the family caregiver. We started with development around the older adult themselves. And it's just been amazing to understand how they engage with products and technology. Almost 65% of our members, which are generally older adult themselves managing on their own behalf, enrolled in text. And so we're leveraging this because we find that they do love texting. They are capable of doing that. They don't want to go to this complex app. And guess what? If you want a pal, you're willing to learn. In fact, our pals educate our members on how to use technology. We've recently released our digital health literacy program specific to some new CMS requirements to assess, educate, and report on whether or not somebody knows how to use digital health. This could be telehealth. This could be a health plan app. It could be other telehealth or digital health tools. And these are not that complicated. But when you have a trusted person in the home that is willing to sit with you and show you and advise you that this could be helpful for you. Hey, you don't have to leave your house. We can help connect you to a doctor. Oh, hey, you could actually set up an automated medication delivery using your health plan app. Oh, did you know your health plan has a reminder functionality? And we're just there with them and making them feel comfortable and showing them. But this isn't rocket science. All of these tools were developed to make it easy for everyone. But we want to make sure we understand those needs and be able to support those people in a nuanced way. So between our pals and our software and our processes, we're able to engage people. And Papa is very, very engaging. People always ask me, what are your tricks to engaging? We have an incredibly small, mighty marketing team. But actually, the number one way to drive engagement, we believe, is developing a product that people actually want. This isn't another kind of gray, sad, experience. This is proactive. This is engaging. This is fun. And it's fun for an older adult. And so we see in some of our populations, almost 30% of the eligible people will enroll in Papa and use it at least once. And in higher needs population, they use it 300% more than a typical MA member because they need it the most. And so the hardest to reach population, Papa sees the highest engagement. Think about that. It's because we built something they need and want.
Well, I'm just thinking about my own parents, right, who live 2 hours from me and live by themselves. They're in their 70s. How do they communicate? How do they engage with me and their grandkids? It's through text. It's through FaceTime. It's through iPhone. it's something that they're doing every day anyway. And, I think there's magic when you can meet that patient population where they are. And everybody has a portal nowadays, but the portal has almost become a dirty word. It's not about the portal. It's about how easy and engaging and functionally savvy it's built so that the end user can do it without stress and without red tape or without hurdles. It sounds like you guys have found a way, not only through the normal forms of communication, but to take the burden off the patient, to take the burden of learning a new platform off of them so that they can access and have a great experience to their healthcare.
Last year, we did over 1 million visits. 95% of those were coordinated by an older adult themselves, either through text, phone call, the web portal, which actually we almost didn't call web portal because we agree it's kind of like got a bad connotation. We thought about calling it like web link or web something else, but actually back in the day, I thought about calling it Project Blueberry because it's just kind of a fun undercover name, which is just like an easy thing to access. But I don't think any other company in healthcare has older adults engaged at this level. And I don't even think it's comparable. I mean, I came from telehealth. I used to joke that the number one way to drive telehealth adoption amongst people in general, not even old people, is to get everyone sick at the same time, which was, obviously a joke. I didn't realize COVID or anything like this, but it was requiring this huge behavior change. Yeah, well, no, I did not predict it. But what I did is understood human behavior. And that's what I think we think a lot about Papa is what do they actually get value out of? Not what am I saying in a presentation or a meeting or, kind of a shiny object that, gets me a relationship with an organization, but what actually gets the older person engaged with the service, making it easy, making it fun, making it engaging, making it valuable. And so we think about that all day long. I don't think there's other companies that do that. They're thinking about how to save money. They're thinking about, how to drive engagement. And the most of the time, the way people drive engagement is crazy amount of marketing and, Facebook ads and all these things. We don't do any of that because we really found something that provides older adults with what we call true independence. You're not that independent if you got to get 10 people to help you. But if we can empower you in the way that you feel comfortable, then that could be through your pal, which it is many times, or it could be through technology, which it is many times. That's actually providing independence. And guess what? That removes the burden from the family. Now you could be a son or a daughter. You don't have to be an assistant. We'll take care of that. We're an extension to your family.
That's a cool dynamic. Not only are you taking the stress and the burden off the patient, but you're taking the stress and the burden off the family too. And I love what you mentioned earlier about, shifting your focus from, the care unit, the family unit, and building a platform, building a tool, building a service that's meant for them so that they can take care of their loved one. Instead, you're going straight to the patient. You're drawing a direct line to the people who need you the most and built something that's meant to engage them and make them a fan of the experience so that they can get the care that they need when they need it the most.
By the way, you can send links to the family so they can track the visit. They can request visits on their behalf. But we find is that it's really actually very empowering to all involved when it's the older adult themselves.
We've detailed trust. We've detailed access, the improved experience. Let's talk about outcomes a little bit. And this might be tricky, right, with the demographic that you serve, but you probably have some amazing stories on how this has improved the quality of health, the quality of life for your patients.
Just like on a like real story perspective, and then I'll talk about some specific outcomes. We had this gentleman, his name is Frank. You can see on our website some of his stories and all the amazing stories we have. He was a construction worker for like 25 years. And he was in Miami, actually, which is where I'm sitting now, on a building, and he fell like 20 stories, broke his back, his neck, all these crazy, really bad situations. He gets a call from his health plan saying, hey, you get access to Papa. And this is like a year or two after his accident. He's able to walk. He has to wear a back brace, but he has trouble. He's lower income. He didn't have a car. He recently lost his job. He's on disability, and he's lonely. His kids actually live in another country. And so not even like you, 2 hours away, or me an hour away, we're talking about 10-hour flight. And so he got this call from his health plan. He actually was ignoring it for a while. He would always talk about this. And he accepted it. And he has this amazing video how Papa saved his life. It got him back engaged with his kids. It got him able to feel happy again, wake up. And then also keep in mind, they helped him in very tactical ways and in emotional ways. So one thing we ask about is, what impact do we have on your physical and mental unhealthy days? Well, we've seen programs that we improve that by 25%, which is massive. A lot of this is like, how do you actually feel? Like, we want to know that. And then the second thing is, do we save the health plan, which is where we mostly spend our time with customers? Do we save them money? We saw in many programs huge ER reduction. So we don't want people to go to the ER, ED room unnecessarily, of course, if they need to. But there's people that go 4, 5, 6, 7 times a year, maybe even more. We saw this news article about a health system, a hospital, one hospital, something like 200 people use the hospital almost 6,000 times. It's because they're lonely and isolated. So we've also seen reduction of ER utilization. We saw one program that did 20% reduction, one program that saw 30% plus reduction. We also have seen total cost of care reduction. We try to focus on those that need it the most. Again, going back to my own example, my dad does not need Papa. We're not going to offer him Papa. We know from his data that he's young, relatively healthy, tech-enabled, has a car, doesn't need it. My grandma more fitting, for that. And so we have this smart enrollment where we target those that need it. We assess their needs. And we're effectively socially prescribing them using our social index, which is an internal algorithm we've developed. Then a pal shows up and spends time with you. And since we're able to target high needs people, we saw cost reduction. We saw a program that did 6% total cost of care reduction up to 19% total cost of care reduction. So by implementing Papa, you save money. And that doesn't incorporate all the other great things we're doing and some of the new programs we're doing around STARS enhancement, which are like getting people to their annual wellness visits or setting up their in-home health assessments, or SDOH program, which is understanding people's needs and then actually solving them. We're not a CBO platform. There's plenty of amazing CBO companies. There's plenty of amazing navigation companies. But for those that we engage, which are high need populations, it's about 20 or 30% depending. Those are the people that need us to help them in their home and provide that trust and coordinate these other services and navigate these other services. And so PALs really being that trusted advisor in the home, or the eyes and ears in a very thoughtful, meaningful way, can lower cost, improve health outcomes, improve quality. People always say, well, everyone says that. We are literally in the home and we are literally driving you to the place, or we're literally scheduling that thing for you, or we're literally setting up that telehealth visit. And so we've built this network of compassionate, mission-minded companions that we are now enhancing using software and process to drive real outcomes, which is something has never been done before. It's like the first social enabled value-based care solution.
You mentioned value-based care, and you're talking about, in a way, you're hitting on some of the biggest trends and challenges in healthcare. One that we haven't named yet is personalized care. And you talked about how you have 30,000 pals, but you've built trust by sending the same pal back to the same house consistently so that they can build a relationship. And then you talked about the improved outcomes and the cost savings. Personalized care must play a huge role in delivering those outcomes, because that pal and that patient know each other almost like family.
You're spot on, and I get the chills thinking about it. I mean, we had done a survey on our pals, and 100% of their members feel comfortable telling them things that they generally are not comfortable telling people. And it's the same as you would get with a family member, ideally. You have that real, authentic relationship that's not there to take advantage of you or do anything other than be your friend. But with that, it's super powerful. We have members that I quote say, listen, I go to the doctor, but if they don't ask me about something very specific, I'm not going to. And so what are you supposed to do in those situations? I personally go to the doctor and I remember all the things I want to tell them right as I leave the doctor. And then I wait 6 months, a year, I go back to the doctor. Same thing happens over and over again. Imagine if you're older, you have memory issues, you have access issues, you're low income, you have health literacy issues. And so the PAL really becomes that guiding light, not only in the home interaction, but with all other services that you may have access to. And members really, really, really rely on their PAL. And we have found this like preferred PAL relationship to be so powerful. It actually happened organically at first. And now we put all this software to better enable that relationship. And by the way, we do in-person visits and we do virtual visits. So last year we did about 1 million something in-person visits. We did about 300 or 400,000 virtual visits. And that doesn't count the interaction that the Palisade members have outside of the in-person visit. So we've recently released a new trust and safety feature, but which is really meant to allow them to connect more, which is mass numbers. So we assign a specific number to an older adult. Talk about educating them how to use technology. If you ever leave your keys in the back of an Uber, like it's very difficult to call the person. For me and you, maybe not, but relatively difficult. Well, this is, we assign a number to, Judy, who's an 85-year-old woman who has a cell phone, but she's not very tech enabled. She calls that number and it'll call Andrew, your pal. If Andrew's not available that day, it'll go to Papa. So you have this dedicated number that is safe and secure so you could consistently communicate. Last year, we did 2.4 million human interactions virtually. This is our assessments, our support team, our pals, our care team, and we get more engagement. We get like 10 times more engagement than any other benefit because people are lonely and people are isolated and they become really comfortable with this individual. And through this relationship, it is amazing the impact you have, which we've shown in studies like I just mentioned. But honestly, I think we're just getting started. I think our opportunity for value to our members and to our clients is significantly more than we've been able to do so far. And that's our mission. 80% of health outcomes is driven by social drivers of health. And we want to be the company to prove that by pairing you to a human, we can solve not everything, but we can help to solve a good majority of your needs.
When I'm having these conversations, similar challenges seem to pop up often. And, oftentimes it's provider experience, provider burnout, staffing shortages, and other things. And we talk about how technology can help scale and automate and make more efficient. But when I hear about the number of visits that you did in 2023 and the interactions that you had with your patient population, and this might be the wrong word to use, but democratizing the access to care for your patients, I think about what stress you're taking off of the traditional health system, especially for a patient population that is higher need typically. And then my mind immediately shifts to what's coming next. And the population is continuing to age. We're living longer than we ever have, and we're having fewer kids. And so this patient population demographic is quickly shifting to the older community, to the more aged community. And I'd like you to talk about that a little bit. I mean, we're living in a time now where we have more 60-year-olds than we do 5-year-olds. So what kind of stress, it's crazy to think about. What kind of stress would that put on the traditional health system if it weren't for services like Papa?
We've seen in the news the burden, as you mentioned, the shortage of care. And frankly, a lot of these providers are not operating at what they would call in healthcare like the top of your license. And I think telehealth is actually a great way, to your point, to leverage technology to make it more efficient, give you more access, support rural communities. But that's one way to do it. It's only going to optimize what we have so much. We believe that there needs to be a new kind of care. And we believe that new kind of care needs to be built on human connection, which is really our core mission. And that's what we're doing. By 2040, there will be a caregiver shortage of 355,000 people. 355,000 people. And our aging demographic is going to double in the next 20 years or so. That's crazy to even think about. And this isn't just happening in the US, it's happening across the globe. And you're right, people are not having as many kids, people are living longer. But in America, unfortunately, people are living longer while getting sicker and poorer and in worse social situations. And so we believe it is critical to have a new kind of care built on human connection, and that's what Papa is doing. And again, this isn't to replace doctor services or home care professionals, which is more around ADLs, which is activities of daily living, bathing, toileting, kind of personal care. We are really in the category of instrumental activities of daily living, which we effectively have rebranded and developed the category of companionship. And so this could allow other providers to operate at the top of their license. this could connect our older adults to these new, more optimized technologies like telehealth or other services. And it can relieve a lot of the stress and burden that is on the current system. And what we did is we didn't go out and say, let's tech enable home care. We didn't do that at all. We said, let's go find a new kind of care. And so our average pal is not a professional home care provider. They're more of a family caregiver. And so, which is also a burden on this country. The family caregivers are not being supported in general for their own family. So we think there's a lot of opportunity. We think we're unique in the market. We are the only company that can, kind of laser focus, deploy a human into the home to help with the problems in a person's life and in healthcare. And we feel very proud to be doing that on a daily basis.
You're providing a new kind of care, a new level of care, of companionship for this patient demographic. When something's new and in an industry that takes a while to adopt new traditionally, education seems to be the most important part, because providers, payers, patients don't know what's available to them without somebody educating them on innovation and new opportunities. How are you providing at scale the kind of education that the entire community needs, the provider, the patient, but also the insurance company, the carrier, the payer? First of all, how important is that education to Papa? And then how are you meeting the demand to get the information, the education to the right people?
When we started Papa, it was this funny moment where we had our first health plan partnership. We were calling members to enroll them. And it's effectively a cold call saying, hey, this is Andrew from your health plan. We partnered with you and we want to enroll you in this new program. We had this interesting dynamic where the members thought it was really great. A free friend is going to come hang out with me. I need a ride. I need this. I need that. I mean, they were very excited. But then most of them were like, wow, this is a scam. And so they called their health plan, and the health plan had this weird dynamic where there were so many calls in to the health plan saying that there's a scam out there. And they're like, no, that's real. So that's when we realized we had to get upfront about education because it was almost like this too good to be true benefit.
Yeah.
And so we've gotten really good at working with our health plan partners, working with their provider partners, working with marketing as well to a degree, but mostly educating our members through the channels that they're comfortable with now. They get mailers from their health plan. They get their evidence of coverage. They hear about it on TV. We've been in billboards. A lot of this is the plan making decisions on how they want to engage, and the brokers who are more and more responsible now to educate people, not only on sign up for this health plan because of XYZ reasons, but here are the things you need for your needs. Here are the things your family needs for their needs. And so it's kind of this multi-pronged approach. And ultimately, since that moment, Papa's made a brand and a name for itself. And they now kind of call Papa and ask. In fact, we used to exclusively have to outbound enroll people. Now it's about 50-50. People call in to us or they reach out to us and they say, oh, I want Papa. I want Papa. They don't even sometimes care about their health plan. They say they want Papa, and then they realize their health plan, and we help them, to understand the benefits they get, outside of our program. And I think it's because it's a paradigm shift to traditional healthcare services. Cold calling an older person, say, go to the doctor, go to the doctor, go to the doctor, like that's not going to really work. That will for some people. You could text them, notification, all these things. With our members, you build relationships and trust for those people. You can get them to do these other things. And we've seen increasing in annual wellness visits. We've seen increasing in medication adherence. We've seen increasing in access to their grocery benefit or access to whatever benefit. And again, we're not a panacea, but we are that in-home support that people truly need. So it's a little bit of, what the name we made for ourselves. It's people asking for help. It's us doing a good job at educating. And it's honestly the number one thing we think we do on a daily basis is provide a really great experience to our members and our users.
You've built a true community, and you found a way to engage, educate, even inspire that community. And when you do that, you create fans of your service, of your solution, of your platform. And when you have fans, they do the marketing for you. They're probably telling their friends, they're probably telling their family about this great service, this great companion that they have in their home that they trust and rely on, depend on, and that companion's made a real impact in their life, in their health. And so the shift from all outbound to 50-50, outbound to inbound, only speaks to that. you've created a community of fans, and those fans, just like fans of our favorite sports team or our favorite restaurant, they're going to tell others about it, and that's how you really grow, and you can see it happening at Papa.
No, it's very true. And honestly, we realized it in the very beginning. We had this member, Sam. Him and I went on the Today Show, actually, when we first started Papa. It was the funniest experience because Sam is a character. This guy's like 97 years old, lived alone, was happy as a clam, like always engaged, except for he needs someone to talk to because his stories are endless. He loved them. And there's this funny photo that he sent us back in the day that it always reminded me of like what we're doing here, which was he sent it to us on his own through a very kind of a standard non-smartphone. And it's like a sad face, like before Papa, sad. After Papa, wow, happy. And he sent it to us, and I'll send it to you after. Maybe we could put up with the post, but that's what we're trying to replicate is give people this independence that they truly feel. And it's not just saying that we're helping them, but actually helping them and getting feedback because we're not perfect. We always try to get feedback and learn and get better and experiment to understand what moves the needle for this user, not every user, but like how do we help David? How do we help Sam? And how do we help whoever? So I like the way you frame it up as a community because it's true. And it's on both the member side and the PAL side. These PALs are passionate. Papa's core values, one of our 4 core values, we only have 4, is powered by passion. And that's true by our employee base, by our team members. That's true by our PALs. And frankly, it's true by our members. My wife's coworker the other day came up to me at an event I went to with them and said, my mom is the biggest Papa fan ever. And it just like made me feel so happy because she gets access to it for free from her health plan. Absolutely loved it. And she uses it mostly to get rides around the neighborhood, rides around the area to go to the doctor. It completely removed the burden from the daughter. She was happy as a clam. And the mom itself felt, wow, someone actually cares about me. And it's not someone like dropping me off and letting me, I'm friends with this pal. Like this is my family member. So it's just amazing. And it makes me so proud, honestly, because, I sit behind a laptop in my house or my office and, we're trying to build a big company and everyone's running at 1,000,000 miles an hour, but just taking a step back and saying, you're actually helping people's lives. It's something that, I am very proud of. And I think everyone at Papa is very proud of.
Well, we talked a lot about the patient experience. We talk a lot about the provider experience on this show, the caregivers, the PALs, having a consistent house to go. Everybody, here's what I'm trying to say. It's not just the older demographic that needs a community. It's not just the older demographic that needs a friend, a companion, somebody to talk to. And in a way, you're providing that service and that companionship, not just for your patients, but also for your caregivers, your PALs that are in the home. And that's got to build great employee engagement and employee satisfaction. You have 30,000 fans, they're getting the 30,000 PALs, and you're delivering companionship to those PALs almost as much as you're delivering companionship to your patients.
100%. So we did a loneliness social health report on 29,000 older adults. And then we also did a mini study on our PALs. In some ways, the PALs are getting more value than the member. And when you talk about loneliness, Vivek Murthy did a loneliness report that he says it's the biggest disease and chronic illness of this modern time. And it talks about older people and younger people. I mean, they're having a loneliness isolation issue for different reasons. One is like in TikTok and social media. One is literally isolated at home by themselves. But the effects in some ways are even more exacerbated on the younger adults. And so we feel that we are actually a platform of people helping people. My mom, when I came up with Papa, said, well, maybe it could also be an acronym, people assisting people aging. And I always thought that was an interesting viewpoint because that's ultimately what it became. I mean, Papa was college students and older adults. Now we have PALs that are 60. We have some members that are also PALs and some PALs that are also members, which I think is unique as well. In telehealth, I can't just become a doctor. Some people are doctors.
Right.
I'm not. But I can be, as a requirement of joining our company, you have to be a PAL. That's one of our other values. And so it's a very interesting thing where the members actually can become the provider. And if you're a 70-year-old young, sprightly individual and you want to help and you get through our process, which is very strict, why not? And guess what? We find some members prefer that.
That's powerful. Humanizing healthcare and actually building meaningful relationships. It's a powerful platform, and I appreciate you sharing some of the stories, a little bit about the macro elements of our industry, and then teaching us about this wonderful service that you've created and are delivering to our community. Before we let you go, if you could make sure that our listeners understood one thing before they left, what's that one thing that you want them to understand?
That loneliness, a leading indicator for other issues that are exacerbated because of it. And we could help solve many of those issues. We recently launched our STARS program, SDOH program, Digital Health Literacy program. These sit on top of our platform, which is companionship and trust. And we believe trust is the most critical element in healthcare. I think something generally the industry has gotten a little bit too far away from. And I think everyone's realizing compassion, care, trust is the key to longevity, health, and happiness. And so check out papa.com to learn more. But the number one thing I would say is call somebody you care about, call somebody you love, go to a neighbor, help out someone, open a door for an older person, because everyone needs a little bit of a helping hand.
Well said. Thank you for being here.
Thank you, David. Thank you so much.